Hello friends and welcome to your YouTube channel, My Expert Doctor. I am Dr. Shalini Singh Salunke, your consultant physician. Through this channel, we intend to provide you health-related science-based authentic information directly from medical experts so that you can enjoy a safe, happy and healthy future with your family. Now, abdominal pains are very common symptoms. It's so common that we tend to treat it by ourselves. We go to the pharmacist for some painkillers, probably use some home remedies. Many of the times, luckily, we get successful in treating our abdominal pain, but sometimes it really causes a lot of trouble. This is because these cases are basically indication of something gross happening to your body. These abdominal pains are because of some underlying condition. One of such condition is gall stone. Now, these gall stone problem or gall stone related abdominal pains are very common. So, if we follow the studies or researches, the data says that 20% of the abdominal pain cases which come to the clinic is related to gall stones. And among these 20% cases, 2% cases gets complicated or really requires some serious intervention. The funny point is, this gall stone treatment is very simple, is 100% successful. But still, some of us falls into that 2% chances of complications which we can avoid completely. So in today's video, we are going to discuss about gallstone related problems. What is gallbladder? What are gallstones? How will we be able to differentiate our abdominal pain from the gallstone related abdominal pain? How can we treat it? Is gallbladder surgery so simple and safe? Why do doctors suggest gallbladder surgeries to every person who has come with gallstones? Is it not problematic that we remove one part of our body? Is it not going to have certain consequences? What should be done to prevent the gallstones? And at the end of the video, we will be discussing certain red flag signs which you must know so that in future, if you get some complications related to gallstone, you can immediately reach out to your doctors. So before starting today's video, just a small request, please watch this video till the end. Also, if you like this video, our efforts, please do share it with your friends and family members. Also, subscribe our channel and press the bell icon so that you can get the information or notification of the upcoming health related videos. So let's start. So let's first understand what's a gallbladder. A gallbladder is a very small pear-shaped organ. It looks green colored and it's peeping from under the liver. So what is its function in our body actually? Gallbladder tends to store and release bile, which is a fluid made by liver to digest the fatty food that we eat. Where is it located? It's located in the upper right part of the abdomen, almost 2 fingers below your ribcage on the right side. So how will I differentiate simple abdominal pain from gallstone pain? You have to combine two things, your risk factor as well as your symptoms. So let's have a look over the symptoms first. The abdominal pain will be like rapidly intensifying in the upper right portion of the abdomen, plus at the center of the abdomen just below the breastbone. Also, there would be pain radiating to the right shoulder as well as pain between your shoulder blades, that is in the back. Along with that, you will have nausea, vomiting. This kind of pain will intensify after a fatty meal. It can come and goes, may remain for a couple of hours. Along with that, have a look over the risk factors. So what are the risk factors for having gallstones? Female, obesity at the age of 40 or more, food which have high amount of fat and cholesterol, low in fiber content, pregnant females, sedentary lifestyle, those who are trying to lose weight very quickly, people who are on estrogen supplements, OCPs, hormone replacement therapies, who might have liver disease, diabetes, family history, or might have blood disease like sickle cell anemia, leukemia. So if you have any of the symptoms or you have risk factors in association, you can think that there's a possibility of gallstone and you should go and check it with your doctor. Now, what a doctor will do for you? Doctor will first ask you some questions. They will try to find out the history and symptoms. Then they will ask you to lie down and will examine your abdominal area to look for pain, tenderness, swelling. After that, they might ask you to undergo certain blood tests like your CBC, liver function test and others. Also, for confirmation, they'll ask you to go ahead with sonography that will show gallbladder stone along with some sludgy part. So after all these things, what next? If suppose a doctor confirms that you have gallstones after your sonography or certain other imaging, they'll advise you to go ahead with gallbladder removal surgery. Now you might ask me one thing, why we are hasting towards surgery rather than going towards a medical course of treatment? So, for gallstones, there is no proven medical treatment that will get rid of your gallstone problem. It can control your symptoms. Yes, definitely, there are certain medicines which will help you that way, but the problem will reappear and the pain will re-happen. The only thing for 100% cure and a correction of the gallstone problem is through surgery. Gallbladder removal surgery is not only safe, it's of short duration, your hospital stay will be shortened and your recovery will be quick. You'll go back to your work within 6 to 7 days of your procedure. Now suppose we have decided to ignore our symptoms of gallbladder stone problem, or we have taken local treatment for it but not have tried to understand the problem per se, or even after understanding the problem we have chosen to take the medical treatment and not the surgical option. Then what might happen? We must be aware of this thing as well. Now, if you can see on your screen, gallbladder, there is a neck of gallbladder which is number 1. Then from there, the bile goes down to your second junction which is the CBD or common bile duct, and that is number 2. Number 3 is your pancreatic duct. Now suppose this gallstone, if the surgery is not done, the stone might dislodge. First of all, it might get stuck in the first part, the region 1, and may cause cholecystitis or gallbladder inflammation, sometimes infection as well. Second thing, if the stone passed down from point 1, it might stuck in junction 2, and that might lead to obstructive jaundice, malfunctioning of liver. Third, if it doesn't stuck over there, it might get stuck over the third point, which is the pancreatic duct, and this is the most painful condition. This might cause acute pancreatitis. Suppose you are lucky and nothing like cholecystitis, pancreatitis or obstructive jaundice happened to you over a period of time, but still there are chances that these stones, if it keeps staying in your gallbladder for a long time, might lead to gallbladder cancer as well, and you might have to go for the emergency surgery. Why emergency surgery? Because all these 3-4 conditions increase your mortality risk, increase your duration of hospitalization, slow down your recovery, increase other complication rates as well, like super infections and everything. So always remember, these complications might land due to emergency surgery, and emergency surgery is always worse compared to elective ones. So take wise decision after discussing it with your doctor. Choose surgery over the medical treatment or wait and watch, whichever way. In this case, let's discuss most awaited precautionary steps for a gallbladder stone problem. Even if you are not taking surgery, you will require this step. The first one is to increase the fiber in your diet. Second thing, you have to reduce your sugar, your carbohydrate intake and your fatty food intake. The third is to do exercise, that is at least for walking for at least 30 minutes or moderate workout for 30 minutes every day. Then you have to maintain a healthy body weight, your BMI between 18 and 24. If you are trying to lose weight, do it gradually, don't hasten up. Preventive medicines like ursodiol, statins, etc., whatever a doctor advises, please keep taking it and keep good hydration status. So these are very simple preventive steps or precautionary steps which you can continue even after surgery, or if you haven't decided to go ahead for surgery or decided to go with the medical treatment, these preventive steps will help you a lot. Now, before ending this video, there is something which is very important. You must be aware of the danger signs of gallstones, which are: number 1, bad pain for more than 6 hours. Number 2, fever with chills. Number 3, yellowing of skin or sclera of your eyes, the white part of your eye. Number 4, urine goes dark yellowish, or your stool become light color. If there is any of these problem, you have to reach out to your doctor immediately and get your gallstone status checked. I hope you have understood everything about the gallstone, but luckily around 80% of the patient with gallstone will have the silent disease, will not have major issues, but the 20%, for those 20% where complication is going to become a problem, this information or this video is going to be very handy. So hope to see you soon with some again health related informational videos. Till then, stay safe, stay happy at your place.